My name is Peg Morrison, and I will be your host this evening. I'm the Director of Programs for the National Alliance on Mental Illness of North Carolina. Thursdays with NAMI is our way of connecting with one another and building community and conversations around the topic of mental health. Tonight's issue is brought to you by popular demand. When we've asked folks what they would like to see on Thursdays with NAMI, substance use disorder has been a top suggestion. Our guests tonight are both clinicians from Triangle Springs, where they provide inpatient and outpatient care to those with mental health and addiction challenges. But first, a word from our sponsors. And I'm going to share my screen so that you can see this beautiful logo. There we go. Thursdays with NAMI is funded in part by the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services through the Federal Community Mental Health Services Block Grant Fund. Thursdays with NAMI is being recorded, so if you have friends who couldn't be with us tonight, please tell them. Don't be alarmed. NAMI believes in second chances, and this recording will be available on our YouTube channel within just a few days. So now I'm so glad to introduce our guests tonight, Amanda Pietz and Monique Sorensen. Amanda Pietz is a licensed clinical social worker who's dedicated the last decade to helping individuals and families overcome crises and build skills, enabling them to live calmer, more rewarding lives. Amanda is currently the Director of Clinical Services at Triangle Springs. Monique Sorensen is a licensed professional counselor who has helped families, adolescents, and adults of all ages to improve their daily functioning and create lasting change in their lives. She's the Director of Outpatient Services. So how are you both taking care of yourselves these days?
Well, just trying to maintain as normal a routine as possible. I know for me, part of that's been trying to find some doable travel, because that's something that I'm missing on now. So trying to find day trips or local hikes that don't require a lot of planning in case things change and you're not able to go, but just trying to get out of the house and do a little mini traveling. And then connecting virtually with friends and family as much as possible.
All right.
Yeah, I would say really similar for me too. I think trying to keep my routine, and for me that involves exercise. I've been lucky in that Zoom has been a thing for my yoga studio, so I've been able to maintain that and do that a few times a week. That really helps me keep my sanity, so during all this craziness.
Yeah, absolutely. I've been Zooming with family and more with work meetings, so it's not the same as face-to-face, but it's good to connect. It gives us something to keep that pulse of all the people that we love in our lives. So let's start with the basics. We'll jump into this meaty subject. What is a substance use disorder? How is that defined?
I would say that's defined as, when the consequences of your use continue to escalate and you still keep using, and that can be alcohol or substances. But that's kind of how we define it in the field with addiction, is just when, the cost keeps rising and you keep doing it. So continue to use despite those negative consequences.
Okay. And I know I was taught, and a lot of folks are taught, that this is self-medication for folks who have really any kind of issue, but a mental health challenge in particular. I'm self-medicating, I'm depressed, I'm anxious, and I'm looking for something to take that edge off. Is that accurate?
Yeah, I would say a lot of times that is the case. People might have a mental health disorder. Sometimes they don't. Sometimes they might have, just stress or past trauma or things that come up for them. And it is a way for them to kind of relieve those feelings. Whether or not that's a disorder or not, they do tend to rely on it for some kind of relief of something. And then it can become a problem when they get reliant on it.
Yeah, and I would also add that sometimes the mental health disorder can kind of appear or seem to appear secondarily. If someone's been using a lot and they've made attempts at being sober and they're, kind of seeing their world falling apart due to their use, the secondary mood component can come in when they kind of look around and say, like, how did I get here and what do I do?
Mm-hmm. Yeah, and I know two people who live with serious mental illness, bipolar, and one is borderline diagnosis. And both of them have said, I had trouble with substance use I joined AA, but really when I got my mental health treatment plan sorted out, I didn't need any of that anymore. Is that fairly common?
I think it can, take away the tendency to self-medicate. Yeah, once you're feeling better, you're able to put the pieces into place to take care of yourself and tackle the addiction.
Mm-hmm. Sure. Okay. So next question. According to reports, well, actually, we kind of covered that already. Sometimes we get ahead of the curve, so that's a good thing. How is trauma related to substance use?
I think, it kind of, just like mental health, it kind of goes both ways. I think people often use because they're dealing with the effects of trauma. It's a way for them to cope sometimes with that. But also when people are addicted, sometimes that creates a lot of secondary trauma. Sometimes those lifestyles create a lot more trauma in their lives. Even though it might have started out as a way to kind of get relief, it can turn into more traumatic situations.
Yeah, well, that brings a lot of heartbreaking thoughts to mind. As someone who spent some time in AA rooms, it's been quite a while since I've been sober, but I do know that recovery community, and there are definitely people who, they ended up in the rooms because they grew up with sexual abuse or had some kind of really difficult childhood situation. And yeah, then they get addicted and then they end up homeless and vulnerable to all sorts of new traumas that can come up. So I've definitely seen that play out.
Yeah.
All right, well, moving right along. Is there a which comes first between substance abuse and mental health condition typically, or does it vary with the person?
I think that varies too. It's kind of like the chicken or the egg, right? I think that sometimes there are underlying mental health conditions that aren't really known, and kind of like what Amanda was talking about, people, are using a lot and then they get sober and then now they're dealing with more of the mental health pieces of what's there. Sometimes substance use mimics mental health disorders, and vice versa. So it's hard to know really until someone gets sober, really all the pieces that are there. So I think it really just varies. I don't think there's ever a specific, this is always how it is. It's really hard to tease out sometimes.
Right, absolutely. So what trends are you seeing among your clients or patients since COVID-19 came on the scene?
I think initially we saw a big increase in patients reporting anxiety and paranoia related to contracting the virus and kind of to the world changing around them, so that, you go to the store and there's people in masks and you're worried who has it. And every time you hear someone cough, you're worried that you've caught something. And I think that was kind of the initial effects that we saw. More recently, it seems that we're seeing a lot of people that have mood symptoms related to the ongoing challenges, right? So the loss of job, the continued isolation, the disruption in their routines, and some of the, existential questions that we're all asking ourselves, like, what do I want my life to be like when this is over? Is this the place for me? Is this the relationship for me? We've had a lot of time for self-reflection. So I think it's gone from that initial sort of anxiety and paranoia to more of a, when will this end and what do I do when it does?
That's a really interesting point. I hadn't considered how all the extra time, and especially the extra time at home, it does sort of push one into taking stock, and that thought process of comparing myself to others, or where I thought I would be at this stage of my life.
Right. And, a lot of increased time with your family and with your spouse and in your relationships in ways that no one's dealt with before. So we've seen a lot of emotional turmoil around those issues. And then also, not just COVID, but all the civil unrest at this time in our country is really causing people to kind of evaluate, who they are and what life's all about.
Yeah, did you have something to add, Monique?
Oh, sorry. I think that's my dogs in the background. There might be a car outside.
Oh no.
Oh, I'm glad they're protecting you from that danger.
Yeah.
That's a good thing. It's a good point about taking stock again in light of the racial tension, the injustice and racial trauma in our culture right now. There's a lot to consider, and I think we're looking at how far we've come, but also our values. How do we compare in that way? So, yeah, lots of reasons to reflect and way too much time to do it.
Yeah, and people are stirred up and tensions are high. So, you know, there's a lot of mood symptoms that are just coming out of the kind of perfect storm of moments in our society right now.
Yeah.
Yeah. And I'll say, I think too, because people have more time right now and there is so much extra stress and chaos going on, that they are seeking help. I think we've seen an increase in the hospital of people really wanting services because they've got time and they really are seeing the need.
Good point.
Yeah. And there's also such a rise in telehealth now for those of us who have that online opportunity. Do you think maybe the privacy, it feels a little more private to some of us on video versus driving to a place and walking into the building with a sign? Maybe that's a little more appealing to some folks.
Yeah, definitely. I think so.
Yeah, I think people who haven't sought help in the past are, you know, feeling like, okay, it's, you know, I'm home and it's right here in front of me and I have this, you know, machine that can connect me to, you know, a step to feeling better. So I think there are people reaching out that haven't in the past.
Right, and it's much more likely to be free, not just low cost, but free.
Great point.
So, yeah, I hope that continues to open doors for people who need help and maybe hesitated for different reasons to get it. I have to think this would be a tough time for someone who's just getting sober or just getting that mental health diagnosis. Any advice for people in that situation?
Yeah, I think, you know, at any time, getting sober and staying sober is something that's extremely difficult, or, you know, coming to a reckoning with your mental health diagnosis. I think it's important to remember that even though we're isolated right now, it's not a time where you have to do it alone. And so just reaching out to professionals and participating in mutual aid meetings virtually is something that's still very much available, and even more so available than it has been in the past. So just not isolating yourself in this time of isolation.
Absolutely.
Yeah, I would agree with that. And I think also thinking about some of the benefits around the increased access, but also for people trying to get sober, like, you know, we are so much more isolated. Hopefully there are less temptations, you know, people aren't out going to bars. You know, there's a lot less of that going on. So it might be a good time to try if it's something you've been thinking about and haven't tried.
You know, that's a great point, and I don't know why nobody's framed it that way in conversations I've had, other than we're just all really negative. But yeah, in a certain way, in a certain way, the temptations are much lower. That's a good point. It's just, I guess, the people I was speaking with were feeling like, oh my gosh, we're all stuck at home together, and the new stress. So that was their frame of mind. But yeah, it could be easier for someone who's just used to going out every night and suddenly they physically can't, or the place they went to is closed. So
the social drinking aspect is, you know, minimized.
Yeah, for sure.
Yeah. So, all right. So unintended consequences can be good. So let's talk about spirituality. For so many people, it's a coping tool. It's very personal. Some people feel they could never do their journey without faith, without God. On the other hand, I know atheists who are so turned off by that, they won't go into the room if that's the philosophy of the group. I actually had a gentleman in a support group I was leading who we were talking about meditation, and I was encouraging him to tell me, is there anything along the lines of meditation that would work for you? And he was hearing it as a God question. It wasn't really how I meant it, but we wrapped up the meeting, and he shared that he was an atheist, and I hadn't known that. I didn't care at all. And my co-facilitator was the son of a preacher. And when he realized we weren't going to judge him, when we were completely and totally fine with his beliefs, he started participating more. He came more consistently to the group, and he became a facilitator ultimately. Anyway, circling back to my question, that story just inspires me, so it popped out. What is the option for atheists that might bring the same benefit as faith, but they don't have to pull God into it?
Yeah, I think for a lot of people who aren't as familiar with 12-step programs, it can be a turnoff because they just think they perceive it as this like very religious organization, and until they go in the rooms, they don't realize that not all of them are that way. And you know, hopefully when they're in other groups, they realize and they hear from other people who have had that experience that every meeting is kind of different. And some people, you know, your higher power can be whatever you want it to be. And some meetings really emphasize that and encourage you to think about other things that you consider your higher power, or whatever that might look like for you. And I know there are specifically to some meetings that are for atheists. They advertise that way, locally even. So I think for those people, kind of hopefully not getting hung up on that piece of it. Spirituality can be anything for anyone. You know, it just kind of depends on the person, and people don't have to be spiritual at all to really get the benefits of the community that those groups have to offer, and really focusing on that piece of it.
Mm-hmm. Yeah, I know someone who I think was agnostic or atheist, and she was actually a board member at NAMI, Ohio. And her view of her higher power was just community, something larger than yourself.
Yeah, that's really the benefit of the rooms, is the community. And that's a piece in addiction that is so, you are so isolated in your own mind from the world. You know, it's you against the world. And I think that that is a big part of why those group meetings are so helpful for people, because they get that sense of community. And that's largely a big piece of what's been missing throughout their addiction.
Mm-hmm. Okay. Any follow-up, Amanda, or anything to add?
Monique did a great job covering that.
All right. You guys are such team players with each other. So we have a lot of folks who are dealing with a whole lot of change right now. They're suddenly working remotely. Maybe they've lost their jobs. If I'm working and I have children, school-age children at home, I'm suddenly a homeschooling mom and I'm working. What are some tips for handling change?
I think first and foremost, just admitting that change is really tough, and that there's a lot of change that was forced upon everybody at once right now, and rapidly. And so just being patient with yourself and feeling like you don't have to have all the answers immediately. You know, it may take some trial and error to figure out the routine that works for your family, what the new normal looks like, and just being patient. I think also searching for your support system now more than ever. So being okay with asking for help when you need it, and leaning on the people that want to help you. And then just, you know, kind of allowing yourselves to mess it up and figure it out.
Mm-hmm.
People are too hard on themselves and too strict on themselves sometimes. And this isn't the moment for that.
Yeah, that's a good way of putting it. Just let yourself mess up. Acceptance, I think, is a big theme that I've been thinking about.
Yeah, it may not be possible to, you know, maintain the life or the routine that you had before. So, you know, it's going to take some trial and error to figure out what that looks like now.
Mm-hmm.
Yeah, and I think the demands of like being at home all the time, trying to homeschool kids and all the things, and like expecting to be perfect at all the things, and no one's going to be perfect at these things right now, given our circumstances. We're all just kind of doing the best we can.
Yeah, I just read an article along those lines that moms in particular expect to be perfect in their career, perfect as a mother, and have a perfect body. Who can do all that?
In normal times, you know,
Yeah.
and there's COVID times.
Yeah.
Yeah. I've also seen like a lot of, you know, grace extended to parents talking to each other right now about, you know, some of their challenges, and, you know what, I'm just giving the kids the iPad today, and, you know, a lot of support, and like, it's okay to sort of be lax with certain things right now.
Yeah. Yeah, I think gentleness with yourself is just so important.
Mm-hmm.
And it's hard to remember that during normal times, and it's just so important. All right, so you kind of covered this. Any thoughts for parents with young children?
Yeah, I think definitely giving yourself the grace for sure, and allowing, kind of like Amanda said, you know, giving them, if you need to, like I know people are trying to limit screen time and things like that. Like, this is probably not the time for that either. You know, if you feel like that's something you need to take a break, you know, it's okay to do that maybe a little more than you normally would. And again, relying on your support system. If you have people locally you can rely on to kind of help out, you know, taking breaks where you can, because it is a lot to be together 24/7 and have all these extra responsibilities, especially if you've had kids in school and now all of a sudden they're with you all the time. You know, trying to give yourself some peace where you can.
Yeah.
And I think, you know, also important to be mindful of the media that you're consuming and that your kids may be consuming related to the virus and related to everything that's going on, and talk with them about what's happening in the world in age appropriate terms, because they're going to have, you know, wonder and have questions. But some of the stuff that you see on the news can be really scary, especially for young kids. So having those conversations, not trying to pretend like, you know, everything's normal right now, but talking to them in a way that's age appropriate and digestible for them.
So I see a note in the chat box that is reflecting on Monique's comment that when I'm in addiction, I feel like it's me against the world. Say more about that, because that is a common theme, that isolation.
Yeah, I think, I don't know, I've just seen it a lot where people get, it's not even because it's weird, people can be in a room full of people and feel alone, right? And I think it's so hard for them once they get to a certain point where they just feel like no one understands them, no one can help them. It's so hard for people that are trying so hard to help them to get through to them. And a lot of it, I think, it becomes like that mentality. It's me against the world. There's no one that understands me. And again, I think finding those group meetings that make people feel like, oh, these people get me, that's when you start to see people getting better. Because people hopefully in that room have had all ends of experience with addiction. They've probably been to treatment more than once. Like, they've been in that guy's shoes before, and they can kind of really speak to them in a way that maybe their family can't. So hopefully helping that person find, again, that sense of community in some space where they are feeling like they're getting what they need from people who have been there and can relate to them.
Yeah, there is a real irony, because so many people, when they talk about their first experiences of using, they say, I suddenly felt a part of, I felt popular, I could talk to people and relax. So it seems like a solution, but fast forward just a little ways and it's a problem again, and it's creating more isolation than you started with, probably.
Yeah, I think that's a really good point too, to remember, especially for people who don't understand how people get addicted to something, that it serves a purpose. In the beginning, usually they're getting some benefit from it, or they wouldn't keep doing it. At some point, the consequences start to set in, and they get bigger and bigger and bigger until they're in this situation that they don't know how to get out of. So having, you know, just that remembering to yourself, like, this started for a reason, and there are things that they were getting out of it, and, you know, it's gotten out of hand now, but, you know, it's hard for them to let go of those things in the beginning that they felt it was serving them.
And what can the loved one do? What are some guidelines if I love someone who's in active addiction?
I think getting help yourself is really important, especially if this is very new for you, if it's kind of maybe the first time you're really exposed to this. There are support groups for families, just like you guys have in NAMI, and then, you know, there are 12-step groups for families as well. It's so important to also get yourself a support group of people that understand what you're going through, because there are other parents out there who have probably been in your shoes and seen these things before, and I think that camaraderie can be really helpful for you too.
And what are the names of the groups for family members of folks with addiction challenges or substance use disorders?
Al-Anon is the biggest one. There's also Smart Recovery, are groups that meet that are not 12-step based in the community, and they also have groups for family members as well.
All right. Any follow-up, Amanda? Or?
I mean, that, I think finding help for yourself as a family member is the most important thing. You know, I work with a lot of family members that are dealing with their loved one having addiction issues or mental health issues, and they are so focused on trying to get together resources and therapy and programming for their loved one, and they're not looking for those same things for themselves. And, you know, when someone in the family or someone that you're close with is going through something like that, all the systems are affected. And so it's important to make sure that you have your support system, that there's children in the family, that they have the resources that they need, so that the whole family's in some kind of treatment. That's often neglected. It's all about, you know, the identified patient, and we're just going to support, and you can't do that unless you have support yourself.
Yeah, and I know in my own family, some of my siblings have children who have the dual diagnosis, and they feel so much guilt and shame. Like, what did I do? What should I have done differently raising this child? And then how do I respond? How do I get my son out of his room? Any thoughts about that?
I think, yeah, it's hard to not blame yourself as a parent. And I think that's where that probably goes above the work of a group potentially, and like kind of working with your own therapist to kind of work through some of those things. There's certainly going to be that in every group of parents of people with addiction for sure, and mental health issues, especially if it's not something that or if even if it is something that they see within themselves. You know, if they have a history of it, they might think they gave it to their kid or something like that. So I think doing your own personal work to kind of work through some of those feelings so that you can show up for your family.
Absolutely. And I see a note in the chat box. Are there any national groups out there for someone who's, for family members who have lost a loved one to addiction?
I don't know of any off the top of my head. You know, SAMHSA, one of your sponsors, is a great resource for things in general related to mental health and addiction. They have a treatment search that might give you some ideas for specifics like that. I can say locally, Duke has really great resources as well, especially for bereavement.
Okay. I'm reading again at the chat box about someone getting help to verify strategies with her son and how much that helps. And she continues to go and things are going well. I'm sorry?
Yeah, I think you need that feedback when you're trying to navigate, how do I talk to this person about this? You know, do I ask them how their recovery is going? Do I ask them how their therapy appointment went? And I think you as the, you know, support person, need somebody that you can kind of ask those questions to and get strategy with. So I'm happy that that person found that.
Yeah, absolutely. I think it's helpful to get a reality check too, because when you're in an intense relationship with a lot of challenges, addiction just has a dynamic, and mental health issues have a dynamic where there's a lot of drama and we question ourselves very deeply. So to have that validation and someone looking at only your point of view and bounce ideas off of, it's really essential. Yeah. Like the two of you, for example.
Yeah.
All right. So in general, with this era of life, COVID-19 and all that you're seeing, does this remind you of anything, either personally or in terms of world history?
I kind of feel like we're living in unprecedented times. Like, this is something that, you know, no one's ever lived through a global pandemic before. And I think we have to give ourselves some slack on no one knows what they're doing and how to navigate the things that are happening right now. We're all doing the best we can. We're, you know, trying to use technology and things that are available to us in new ways. It's just been, yeah, I don't think anyone was prepared for something quite this big, to disrupt their routine and their lives. We're all just trying to figure it out as we go, I think.
Yeah, Monique and I actually talked about this topic today, and just trying to think of, you know, what it's comparable to, and nothing comes to mind. I mean, every aspect of life looks, you know, at least slightly different right now. So I think, you know, that goes to show, you know, why people are struggling so hard. We've never been through anything like this. We don't know anyone that's been through anything like this. And so everyone's just kind of figuring it out day to day.
Yeah, we're definitely learning as we go. And that's my response too. That was my initial response. This is completely unprecedented. However, I have an older brother who slammed all of us with emails about the Spanish flu pandemic of 1918. So now
We were,
that's what I think of.
well, if we had been there, we could have drawn from that and had some good advice for you guys, but
Yeah, we'll just have to build our resilience as we go.
right.
What gives you hope?
I think, just the ways in which people have kind of band together during this time. You've seen a lot of efforts put towards reaching out to people in the communities who are sick. And, one of the places that I volunteer is the local animal shelter, and they've done a lot of work. Food out to families that might be stuck at home or may have lost their job and can't afford pet food. So we've had, there's been across the community, I think, a lot of creative ways to sort of support people financially, emotionally during this time.
Mm-hmm.
Yeah, I think so too. It gives me hope too that people, like I said, are seeking treatment, and in people that have probably never considered that before. So it gives me hope that people are getting help for themselves and want help for themselves.
Okay. Another chat from the chat box. Is there something, if I have a child with a mental health diagnosis, is there something I can do to help them avoid addiction later in life?
I think with any child, and especially ones that have mental health concerns, getting them help, getting them involved in help where you can, knowing that you can't do everything for that child. And also just having those open conversations, creating the safe space for them to talk to you about things. I think often, especially teenagers get into things and they are afraid to tell their families what's going on or how they're feeling. So just trying to create that safe space for them that they know that they can come to you without getting in trouble or without feeling like you're judging them. That can be really hard sometimes, but I think we have to set limits, of course, but also be realistic about, what's going on and not panic or show our panic when our kids come to us with something that maybe we weren't expecting.
Yeah, that's a tough one, is sort of regulating our own response, regulating our own energy, because definitely we will affect their energy.
Yeah.
Yeah, the other person. All right, so I'm seeing a lot of questions here in the box. A nice comment from Marianne Weidenhouse. The shareproject.org in Haywood County in Western North Carolina was founded by two mothers who both lost a child to overdose. And I do have a friend who was planning on joining us tonight who lost a child the same way. So yeah, in this era, pre-COVID-19, that's been a huge thing, is overdoses. And as I mentioned earlier, before we started recording, I moved from Ohio a couple of years ago, and boy, Ohio is a serious hotspot for addiction and overdoses. So why don't we move on to our video of the week, and then we'll move on to our Q&A, because I can tell people are generating a lot of questions, so I want to make sure that we can accommodate them. Okay, so this is kind of a fun moment, our video. Tonight we have a silent film featuring our office mascot, Roxy Morrison, and she is wearing, let's see, should be able to enlarge this. Can y'all see Roxy?
We can, yeah.
Okay. So she's wearing her rainbow bandana to honor the end of Pride Month as June. And we've been lining up wonderful programs for July Minority Mental Health Month on Thursdays with NAMI. So she's helping us announce that as well. All right.
Thanks,
So our
Roxy.
very serious and hard-hitting video of the week. I also want to take this time to thank our helpers. We've got our producer, Wes Thomas, our volunteer extraordinaire. Our NAMI North Carolina helpline manager, Virginia Rodias, is working the chat box. So any link that magically appears after it's been mentioned during the conversation, we can thank Virginia for that. And also I know Gary Kreitz, our executive director, is loyally here. Frequently Gail Pruitt, our administrative assistant, is too. So I'm going to thank her just in case she's out there. Okay, so Q&A. We've had a couple questions here for a while. I think there's a lot of interest in this topic that's coming through. If you had to name 3 top things to help to regulate emotional trauma, what would they be? I think maybe that goes with emotional regulation that follows trauma. That's how I'm reading it.
I think there's a lot of things that come to mind, but I think allowing yourself to process. I think when there's trauma, we often want to hide from it and ignore it. So finding the space, a safe space to process that, with family, with a trained professional, whatever is most comfortable for you. Too often we ignore it, and then it just kind of sits and lingers in our minds and in our bodies, and it'll show up in places we don't realize because we haven't addressed it. To me, that's the biggest thing. And then I think just finding ways, like I said, trauma is often stored in your body. So finding ways to keep yourself active and mindful of, where things are showing up for you physically in your body. The mindfulness, the meditation, those can be really powerful things for people who've experienced trauma. It often feels very uncomfortable because, again, people want to ignore it and not feel that discomfort, but allowing yourself the space to observe it and notice it without hiding from it.
So when you say noticing that trauma in your body, does that mean like a headache or a stress, some muscle tension?
Yeah, I think it can be any of those things. It's going to vary from person to person. You might find things that you wouldn't think are related to your trauma, maybe some nausea or the headaches. It can manifest itself in very strange ways that are very somatic, and people wouldn't naturally associate that with trauma. But often when you work on the trauma and you start to heal, you find that those somatic symptoms tend to lessen.
Right. Okay. Any other thoughts about emotional regulation?
I would add, learning a few skills or a few practices that feel good to you as a way to kind of escape it in the moment when you need to. So, it's something that you want to process and that you want to put time into thinking through, but there are also where we can't really deal with it because we have other stuff that we need to do. So learning things like paced breathing or progressive muscle relaxation, things that you can do to kind of turn your mind off for a few moments or a few hours so that you can take care of the rest of life.
Yeah, that makes a lot of sense to me. I think the self-soothing behaviors and anywhere where you can sort of overlap the feeling of comfort with the feeling of control, because those are areas that get so disjointed when we're suffering. So, all right. I think we covered that question. Thank you for that. The next one, you said that taking care of the underlying mental health concerns sometimes helps to resolve the substance abuse. Can substance abuse be resolved without treating the underlying mental health concern? Good question. Tough one.
Yeah, I think it's hard. I think a lot of times, most of my work initially started on addiction, and I think we kind of had the mindset of you got to get sober before you can get healthy. So, working on the sobriety piece sometimes is a little easier. It's more tangible sometimes for people. It's, I just removed this thing from my life, so I'm sober. And sometimes that makes it a little easier to help with the mental health concerns and really address what shows up there. Sometimes people feel worse when they get sober mentally, just because after they get over that initial great feeling of being sober, all those feelings come up they're not used to dealing with. So I think for a lot of people, it makes sense to get rid of the substance and then really work on the mental health.
That makes a lot of sense to me. There's sort of a honeymoon period, like I did this, I've got all these new friends, and then it's like an avalanche at some point. All the things you've been carrying with you just start to fall down.
Yeah.
I think when you're dealing with it, it's hard to see what the actual symptoms are until that's up. And so you're not able to really treat that because the symptoms mimic each other, and it's hard to tease out what's caused by what. So I would agree with Monique. Generally speaking, most clinicians are going to recommend that you kind of work on that piece, and then let's see what was the underlying cause was and what we need to work on now that we're sober.
Absolutely. Yeah, well, thank you. I think we've got a lot of angles covered for that one. What supports are there for children who live in households where a person has an addiction? We often forget the children need help too.
So Al-Anon, which Monique mentioned, would be a good source. And I also think, you know, if they're dealing with a parent that has addiction and there's another parent who's really trying to, you know, be the one to step up and be the support person, the child may need to meet with someone and do individual therapy or group therapy to kind of process the feelings of the dynamics in the home. So I think, you know, that goes back to, we have an identified patient in the family and we're going to get them all this help. But the whole family system struggles when someone's going through a substance use disorder.
Yeah, absolutely. Is there a book that you've read or that you recommend to people that gives hope or helps with skill building?
There are so many books. I know one for families specifically, Smart Recovery makes a book. It's a handbook for friends and family that I think is really helpful for people just to see kind of the tangible aspects of what's going on and how they can be helpful. That's the typical one that I would recommend.
Okay.
Yeah, and I really like any sort of DBT based workbook, because I think there are a lot of you know, tangible sort of coping skills and coping mechanisms that even if you don't, you know, learn the full model, that you can pick up and use as needed to deal with, you know, emotional dysregulation.
Absolutely. And of course, DBT stands for Dialectical Behavioral Therapy.
Mm-hmm.
And that was developed by a doctor named Marsha Linehan specifically for folks with borderline personality disorder. But many, many, many people have benefited from dialectical behavioral therapy. And then there's a question in the chat box. Could you please repeat the name of the workbook?
I just said a workbook about DBT. So there is one in particular that's geared towards adolescents. I can't remember the exact title, but any of the DBT workbooks that are working you through the skill set could be useful and could be something that people, it's digestible enough for someone to do on their own, even if they're not in the full model DBT therapy.
Mm-hmm.
Monique, do you know of one in particular?
No, I mean,
That's something we could send after me.
Yeah, for sure. But there are good ones that are just a whole book of worksheets that are easily digestible, like you said, and they make them so that they're spiral bound ones. So it's really easy to make copies of individual pages and that sort of thing.
Yeah, I would agree with that. And we'll definitely send out those resources after the program. Dialectical behavioral therapy has different components that you focus on, including mindfulness, emotional regulation, self-soothing. And they're all really, really helpful. So there's a question about schema therapy. Are you familiar with schema therapy?
The book that Virginia just posted in there is the exact one that I was talking about. So thank you, Virginia.
So yeah, the workbook that was mentioned is now in the chat box. Schema therapy, any takers on that?
I'm not very familiar with that, actually.
Okay, so that was from Gary. If you want to say more about schema therapy and maybe reframe the question with a little more detail, that would be helpful. So I'm not seeing new questions. If there are more questions from our virtual studio audience, now would be a good time to put those out. All right, well, I'm seeing a lot of thank yous and excellent points in the chat box as I look over a lot of different comments from people. We sometimes end the show at 8 o'clock if we the energy seems to flow in that way and there isn't more to say. So it's not mandatory that we keep you for the full 90 minutes, but we do have an excellent resource here, two excellent resources in Amanda Pietz and Monique Sorensen. Oh, there's a good question. How do you find a good match with a therapist, especially when you're looking at virtual visits?
So a lot of therapists that are doing the virtual visits will offer a free consultation. So they'll you know, advertise that we can do a 15-minute phone call and see if maybe we would be a good fit. And you may not know after 15 minutes, but I think you get kind of a feel for, is this does this seem like someone that I would be comfortable talking to? Did the conversation flow? So I think sometimes it takes trial and error and actually meeting with that person a few times to decide if they're right for you. But I know a lot of clinicians are offering that.
Mm-hmm.
Yeah, I was going to say the exact same thing. And I think, it is kind of weird being in the virtual space and not sharing actual physical space with someone when you meet them. So I think just taking that into consideration, that to question, am I feeling weird just because this is virtual, or am I feeling weird because I'm not sure I fit with this person. So kind of giving yourself some space to process that a little bit.
And I would say therapy usually feels weird in the beginning anyway.
Yeah.
Personally, or in person, if it's something you've never done before, it can, feel pretty awkward. So if awkwardness is the only feeling, maybe don't be turned off by that, but you can kind of get a feel for somebody through a consultation and shop around a bit.
Yeah, that's a good point. It does take a while to warm up to a situation where you go in and unload your deepest concerns and share all the moments that are so difficult that you normally don't want to talk about them ever. So if you can get past that.
Yeah, if you can get over that.
Yeah. One thing we say to folks who call our helpline is that NAMI cannot recommend a therapist, but if you attend our support groups, you will get lots of information about what therapists people like, what therapists people haven't had such great experiences, agencies as well. So our grassroots really have a lot of good information out there. Okay, we've got another question in the Q&A box. It's helpful, virtual studio audience members, to put your question in the Q&A. If you don't know where that is, it's at the bottom of your monitor. If you roll the cursor over the bottom of the monitor, you'll see a little Q&A icon. If you click on that, you can type your question in the word bubble and magically it will appear to us. So that's easier for me to track. So here we go. What is something or several things that you'd like people to know in regards to addiction and people with addiction? Sounds like an opportunity to do some stigma busting.
Yeah. So something people to know about people with addiction. Yeah, I think that, kind of what we talked about already this whole night is just that they are people who were probably getting some kind of benefit out of that, some kind of relief from some sort of suffering. And, it might seem crazy to think that people get to this place where they're doing all this stuff and there's all these bad things happening, but there was a place in the beginning that it was offering them something. And that is it's a very natural human experience to want to feel those altered states of consciousness and get some relief from their suffering in ways that immediate relief that they get from some of those substances.
Mm-hmm. Yeah, I've heard speakers in the latest research that there's a difference in the brain chemistry of folks who have substance use disorders, that for these folks, chemicals actually hijack the pleasure center of the brain. So for all of us, we go through life and really we're looking to feel good. And if I'm nice to my mom, that makes me feel good. If I do well at my job, that makes me feel good. But if this chemical is hijacking that feeling so that all of your motivation points you in only one direction, it's hard for those of us who don't have that to understand. And even in the animal kingdom, in Australia, they study wallabies and their attraction to fermented fruit, and 10% of the wallabies, just like 10% of humans have addiction challenges, 10% of the wallabies kept going back to the fruit, even though they were getting sick and facing consequences. So it is a difference in brain chemistry. I hope that helps people understand and maybe judge a little less. Mm-hmm. It is a challenging thing.
Yeah, I think there's a really great resource I used a lot when I did groups. It's called Pleasures Unwoven, and it's a little older, but you can find it on YouTube too, some of the pieces of it, and it talks about how addiction is a disease of choice, and I think it explains it in a way that people can really digest it and helps in that way.
Okay. All right, I think we're ready for the next question. Are there some serious and persistent mental illnesses that are more likely to be attached to substance use?
I mean,
that's a good one.
Yeah, that is a really good question, and I'm trying to think if anything comes to mind. I mean, we really see it across the board. People may have seemingly mild depression and anxiety, and develop a substance use disorder, and then you have patients that have bipolar and drink or abuse substances in both manic and depressed states. So Monique, do you have any thoughts on kind of what you've seen and if you've noticed any trends or any patterns?
I think it is really across the board, but I agree with the bipolar thing that it could be in either phase, but I feel like bipolar people often feel so out of control. It gives them a sense of control. And there's also some compulsive behaviors, I think, that go with mania that maybe makes it more likely. I don't know if that's statistically true, but I think I see that show up quite a bit. People want to get that opposite feeling that they're used to. So they might use stimulants when they're depressed, or they might use depressants when they're feeling too manic, if they don't like that feeling, which most people do like that feeling. But if they're trying to slow themselves down, they might try and take some depressants, and it can get out of control.
That makes a lot of sense. I mean, even on a good day, most of us are chasing that feeling of peace.
Right. How do I find the middle?
Yeah.
Exactly. Okay. So here's a comment from the Q&A box. I've been in a 12-step program and in therapy, and I like having more tools in my metaphorical toolbox. I've benefited from both in different ways. Unrelated, are there some good resources for meditation?
Yeah, I think there are so many guided meditations on YouTube for sure. If you like the guided thing, there's a really great app that is free. It's called Insight Timer. They also do a lot of guided meditations that are really wonderful. There are a lot of great resources on the web. I mean, I don't know if you have any favorites too.
There's a lot on YouTube. That's usually where I turn to, because you can select, one that fits the amount of time you have. But there's a lot of guided meditation just on YouTube on your phone or your computer.
Mm-hmm. Yeah, personally, I use an app on my phone called Headspace, and it costs about $9 a month. For me, it's completely worth it because there are so many choices. You can do 5, 10, 15, or 20 minutes. You can choose a theme, whether it's sports performance or getting over depression. It's very user-friendly and has a lot of nice options.
Did Headspace do any free subscriptions now during this time, or were they one of the apps that offered that? I know a few of them were kind of modifying the memberships.
We will research that and follow up. That does ring a bell now that you say it. Yeah.
Another one that I looked up before was an app called Sanvello.
Mm-hmm.
It has some meditation and also just some like sort of mood check-ins and suggestions on symptom management.
And how's that spelled?
Sanvello.
Sanvello.
Yeah, and they had been doing a free trial period during this time as well.
Okay.
And also for people that are into the 12-step meetings, I think refuge recovery is a space that they really focus on the mindfulness piece of 12-step. I think there are a few meetings locally as well.
Great. All right, good information, stuff I've never heard about before, so thank you. Here's one on harm reduction. It's a controversial issue here in our area. Any comments on harm reduction?
Yes. I think in the field you have to meet people where they are, and sometimes if keeping them alive is what's working, then you got to kind of go with that. And that might look different. I think sometimes when people think harm reduction, they think needle exchanges and kind of the extreme versions of that, but it can just mean reducing the amount that you're using to a space that is attainable and it's not going to kill you. If we can get there, then maybe we can work towards sobriety, but we kind of got to get to a space that you're willing to meet me at. And right now that is staying alive and staying safe. So whatever that looks like, and it might be different from person to person.
Mm-hmm. And I think when you approach it with a all or nothing mindset, you're really met with that. You don't understand. I can't do that. Like you don't know where I'm the world's against me. So, starting from a place that, like Monique said, of, well, what can you do now? And what does that look like? And kind of giving them some power and control over what's going on is important.
Mm-hmm. I really like how person-centered those answers were, both of you. I worked for a number of years in supportive housing in Toledo, Ohio, and there was kind of a similar question around the topic of housing first. So 2 schools of thought: you have to get sober before we will house you, or if you have housing, maybe it'll be easier to get sober.
Mm-hmm.
And I think it's so important to accept people where they are and do everything you can to get their basic needs met, so that they can learn more about self-care and rise up, get that confidence to recover because they have a roof over their head. That's my opinion.
Yeah, and not further isolate people by, setting them up for an expectation that they can't meet at the time.
Right. Another good point. What are some frustrations you deal with in providing therapy?
I think I think when
Kind of a tough one to
people, yeah, I think the hardest things are when people want it, but they're not ready. It's hard to make a change happen with someone who really isn't ready to make a change. On the surface, they might think they are ready for it, but then they're not willing to do the work. So until they're really willing to make some changes and make some sacrifices, you get stuck in this place where nothing's happening.
Mm-hmm. Yeah, where as a therapist, you feel like you're kind of providing the tools and the support, and things kind of go backwards, or the person, kind of falls off. And I think that's the most frustrating, when people aren't quite ready. But I mean, not even frustrating. I think you're always happy that someone's attempting and that someone's trying. And you can't make people do the right thing or do the healthy thing if they're not there yet.
I imagine that would be frustrating and perhaps at times heartbreaking, because you see the person really wants that safety. They want to do better. They want to protect their inner child, if you will, but they, for whatever reason, don't have the skills or resources. Something's missing that they can't do it.
Right.
That would be very challenging. And I give you a lot of credit for the work that you do. Similar to our NAMI volunteers, I say this all the time. You chose a profession where you put your heart and soul in. The return on investment is more in terms of fulfillment and spiritual, I suspect, than resources or monetary gain. So you're doing a lot of good in the world, both of you, and we all appreciate you.
Thank you.
Okay, question from the field. How can we best communicate with an addicted loved one?
I think if you're in a relationship or you have a loved one that's addicted, you have to set really clear boundaries. I think that's really hard for a lot of people. It's really easy, especially for moms, to enable, or, we're natural enables when we're in a mothering role. It's hard to set firm boundaries, but to understand that sometimes setting boundaries is showing love. Tough love is love too. And I think sometimes, as challenging as that is, that's what an addicted person needs. They need some tough love. They need some boundaries, because maybe they haven't had them before, or they've been able to kind of manipulate and get away with things, and they have to stop being able to get away with it to see those consequences and feel them, to be inspired to make that change.
That's a really good point. I have a family member who had a child where that was kind of the dynamic, and he had given his son an ultimatum to, you must either get a job or come up with a volunteer opportunity and not smoke pot in the house. Those were the rules by this date. And the son did not do it. And the family member is not a flexible person. I mean, he understood the importance of consistency. It was very easy for me as an outsider type of family member to say, well, have him come and stay with me for a while, because you guys have painted this into a corner.
Yeah.
So he stayed with me for 6 months, and he was a pleasure. For him, just getting into a new space and having a little breathing room was very helpful, and he's doing very well now. He's got a good job. But yeah, it's tough.
Yeah.
If you make, I don't want to say threat, but if you make a promise and outline consequences, you've got to deliver, even though it's very painful.
Yeah, I think the ultimatum things tend to not go well. I like that you bring up that example, and it brings me back to when I used to work a lot with families and teenagers that had substance use problems. A big topic that would come up was influence versus control. And as much as you want to or think you can as a parent, you can't control another human, but you can work on how you influence their behavior. And boundaries are a really good way to do that, as well as the communication.
Mhm. Okay. Next question. I need help communicating with my loved one who has a dual diagnosis. We are exploring Dr. Xavier Amador's LEAP program. I know that's an acronym for listen, empathize, and then something with an A and something with a P. It's used in crisis intervention team training. Feel free to put that in the chat box, somebody. I know somebody knows what LEAP program stands for.
There it is. Virginia got it.
Anyways, any thoughts on communicating with a loved one with dual diagnosis? The name of his book is I'm Not Sick, I Don't Need Help, so I'm assuming denial is a big part of this.
Yeah, and kind of going back to something that we talked about earlier, having somebody that you meet with individually that's clinical, that you can bounce ideas off of and share frustrations with, because, you know, a lot of the communication can feel really frustrating. And so instead of hitting a brick wall with the person you're trying to help, having, you know, someone that can give you a clinical perspective and give you feedback is going to be really important in navigating that relationship. And that might be part of the program that they're talking about, that what that offers. It says listen, empathize, agree, and partner. Okay.
Yeah, so we've got the official answer now.
Yeah.
Nice. Okay.
As Amanda said, listen, empathize, agree, and partner. Okay. I need help communicate. Okay, so that was a repeat question. Are there any other questions? Some of these are, we've got a lot of follow-up on that question, so here we go. A mother called her daughter, and they have a court date for sentencing. Mom wants her daughter to receive the help she needs. However, the daughter is willing, but treatment centers have not been long enough. She is from Gastonia. How can I help this mom and daughter?
Treatment centers have not been long enough. So saying that the programs maybe haven't been long enough.
That's how I'm reading it.
Saying.
Mm-hmm.
Yeah. And I think that, you know, is a struggle that we hear a lot. A lot of the inpatient programs are either actually short or seem really like a short period of time to do so much work. So, you know, you may have a hospitalization that's, you know, 7 days. You may go to a treatment center that's 30 days, but this is work that goes on and on. And so I think kind of looking at what a good wrapped up aftercare plan looks like after those hospitalizations. So if the program's, you know, only 21 days, what are we going to do after? Because to step down from something like that and just go home and do, you know, weekly therapy is not going to be enough. So I think that's where things like partial hospitalization programs, intensive outpatient programs, even multiple times a week individual therapy come in. And so I would recommend, you know, taking whatever residential treatment is appropriate and is that the family member is willing to do, and then making sure that there's a really good support system to greet them when they come home.
Mm-hmm. Absolutely. Yeah, I think when I put myself in the shoes of a family member and I've got someone coming home from inpatient, how do I walk that line between I want to help, but I don't want to enable, I want to support them, but I don't want them to feel crowded or stifled with my help. I mean, maybe when they get home, they sort of want to clear their head, if that makes sense. How do I manage that balance?
I think you sincerely ask, is there anything I can do? Is there anything that you need? And you don't assume that you know what that person needs. I think that you offer a menu of choices and give control back to that individual, you know, even in developing the aftercare plan, if that's something that you're taking part in. Maybe finding a list of people who offer therapy locally and giving it to that person to make their own choices. I think, you know, family members often want to be the fixer. And so we're going to set you up and we're going to get this program for you and you're going to do it and you're going to be fine. But I think, you know, that's an opportunity to really give control back to the person, you know, help, be supportive, be genuine and sincere in asking what they need, but give as much control back as you can.
Yeah, I agree with that completely. I also think a lot of these programs that they're in offer some kind of family component, and taking advantage of that while they're there to really have a piece in it and get a better understanding of what's going on in their world and their inner world can be a really great opportunity for people to help.
Mm-hmm. Is it appropriate sometimes for the loved one to say, I know we've had communication problems. I haven't always understood where you're coming from, but I really want to hit the reset button. Would that be better to convey through actions or words or both?
I think it would be nice to hear, you know, if there's been a lot of family conflict and, you know, everyone's trying to start again. I think it never hurts to say things like, you know, let's try this again. You know, let's find new ways to communicate. I'm committed to being a better support for you. I recognize that there's been times in the past where I've attempted to be supportive that didn't feel very supportive. So I think, you know, clearing the air is always a good thing to do, and then to follow through with action, of course, because if you don't follow through with action and you're just clearing the air all the time, you know, loses its effect.
Absolutely. Okay. Here's an intense question. Is substance abuse ever a type of suicide?
I would say no. I mean, it's certainly not a very effective one. It's a slow, painful thing to put yourself through. I think maybe sometimes people do want to punish themselves, and that could be, substance use could be that, perhaps. For some people, they may feel, I think again, though, it's in some way, shape, or form, it is dealing with some kind of struggle that they have going on, some kind of suffering. And maybe that's the way they justify it, as they say these are intentional things they're trying to do for themselves. But I think often it is an attempt at a relief from suffering, whatever that means.
Yeah.
Mm-hmm. Mm-hmm. Okay. Follow up to the Gastonia situation. I plan to advocate for the daughter in court versus going to jail. And that's from Diane Crisanda. We appreciate all your hard work out there in NAMI South Mountains, Diane. All right, that was the last question for a while. So you've got a couple minutes if you got another question you'd like to submit or a comment for Amanda or Monique. Appreciate all of you in our virtual studio audience for sharing parts of your stories, for sharing your time with us tonight. You know, it is a challenging topic. It affects way too many people.
There were some great questions in there and a couple of things that I'm going to look into as well and learn a bit more about. So thank you for the questions.
I always come away from our programs on Thursdays with NAMI feeling like I've got some new insight on something, and always feeling reconnected to NAMI. Like, I know why my heart is in this. I know why I choose to do this. It fills my cup. All right, what is the best inpatient treatment center you can recommend?
Locally, I mean, I think it depends on where you are and what you're looking for. I don't know if there's any details they want to provide to give a better answer on that.
Well, the question came from the western part of the state.
Okay.
I have to say I'm impressed. I figured you'd both say, well, Triangle Springs.
Yeah, we don't want to give a biased opinion.
So they're not talking locally necessarily.
Yeah.
A dual diagnosis, mental health, and substance abuse. She did not specify a location. I know sometimes people can travel for a treatment.
Yeah,
well, certainly Triangle Springs, we treat both mental health and substance use. A thing to remember about a lot of the local hospitals, though, is that they are short term. So it depends on whatever kind of treatment the person's looking for. An acute hospital like Triangle Springs would treat immediate safety concerns, detox, things like that. And then if they're looking for like a longer term program, that would be found elsewhere. But part of the discharge planning that we do with patients when they're in the hospital is kind of seeing what they're going to need for the next step. So making recommendations, you know, based on their diagnosis and where they live, making recommendations on treatment centers or outpatient programs.
Yeah.
Okay.
And I think too, depending on if it's the mental health first or the substance use first, some centers are specific. They can only treat one that's the primary. So sometimes that can throw a loophole in things depending on how that's diagnosed.
Right.
Again, SAMHSA has a great tool on their website that's a treatment finder, and you can kind of search that way.
Okay, so Rutherfordton and Gastonia, that information was provided as you were speaking. I didn't want to interrupt. But again, and I know the person who wrote this is aware of it, but for our other virtual studio audience members and for anyone watching the recording, I'd strongly advise you to attend a NAMI support group or another type of support group and get information from people who have that lived experience and can tell you, this was my experience with this or that provider.
Yeah, I would recommend that as well.
Okay. Well, I don't see any more questions. I want to thank everyone. It's not too late, but I'll say some of my words of thanks before we head up. Again, thank you to Virginia Rodias, our helpline manager and chat box coach tonight, and Wes Thomas, our producer, volunteer. Gary Kreitz for always being on the webinars each week and asking insightful questions. I think it feels like our energy is winding down. Again, we don't stay the full 90 minutes because it's mandatory. We stay as long as we're being helpful and the time is productive. But thanks to everyone for being here tonight. Another 72 minutes have flown by in this case. And I want to encourage all of you. Well, I want to really, really thank our guests tonight, Amanda Pietz and Monique Sorensen, for sharing your insight, for sharing your personal thoughts, and bringing us together with so much good information tonight. And remember, all of you, go where you need to go, do what you need to do, but be safe out there. And have a wonderful evening. We'll see you next week.
Yes.
Thank you. Good night.